COVID-19. Top 10 Facts You Need to Know. The World Couch. Facts on everything all around the world. What is coronavirus? Coronaviruses are a large family of viruses. They may cause illnesses to humans or animals. Several coronaviruses are known to cause respiratory infections ranging from the common cold to more severe diseases. Example of these diseases are MERS or Middle East Respiratory Syndrome and SARS or Severe Acute Respiratory Syndrome. The most recently discovered coronavirus disease is the COVID-19. What is COVID-19? COVID-19 is the infectious disease caused by the most recently discovered coronavirus. In December 2019, an outbreak began in Wuhan, China with this unknown new virus and disease. What are the symptoms of COVID-19? The most common symptoms of COVID-19 are fever, tiredness, and dry cough. Some patients may have body aches and pains, nasal congestion, runny nose, sore throat, or diarrhea. These symptoms are usually mild and begin gradually. Some people become infected but don't develop any symptoms and don't feel unwell. We call them asymptomatic. Most people don't need special treatments to recover from the disease. Older people, and those with underlying medical problems are more likely to become seriously ill and develop difficulty breathing. Who is at higher risk for serious illness from COVID-19? Older adults and people of any age who have serious underlying medical conditions might be at higher risk for severe illness from COVID-19. Based on what we know now, those at high risk for severe illness from COVID-19 are people aged 65 years and older, people who live in a nursing home or long-term care facility, people with chronic lung disease or moderate to severe asthma, people who have serious heart conditions, people who are immunocompromised such as cancer treatment patient, bone marrow or organ transplant patient, person with immune deficiencies, and people taking immune-weakening medications. People with severe obesity, people with diabetes, people with chronic kidney disease undergoing dialysis, people with liver disease. How long does it take after exposure to COVID-19 to develop symptoms? The time between exposure to COVID-19 and the moment when symptoms start is commonly around 5 to 6 days, but it can range from 1 to 14 days. How does the COVID-19 spread? People can catch COVID-19 from others who have the virus. The disease can spread from person to person through small droplets from the nose or mouth, which are spread when a person with COVID-19 coughs or exhales. These droplets land on objects and surfaces around the person. Other people then catch COVID-19 by touching these objects or surfaces, then touching their eyes, nose, or mouth. This is why it is important to stay more than 1 meter or 3 feet away from a person who is sick. Can COVID-19 be caught from a person who is asymptomatic or has no symptoms? COVID-19 is mainly spread through respiratory droplets expelled by someone who is coughing or has other symptoms such as fever or tiredness. Many people with COVID-19 experience only mild symptoms. This is particularly true in the early stages of the disease. It is possible to catch COVID-19 from someone who has just a mild cough and does not feel ill. Some reports have indicated that people with no symptoms can transmit the virus. It is not yet known how often it happens. Is there a vaccine, drug, or treatment for COVID-19? To date, there is no vaccine and no specific antiviral medicines against COVID-19. However, people, particularly those with serious illness, may need to be hospitalized so that they can receive life-saving treatment for complications. Most patients recover thanks to such care. How can we protect others and ourselves if we don't know who is infected? The most effective ways to protect yourself and others against COVID-19 are to clean your hands frequently and thoroughly. Avoid touching your eyes, mouth, and nose. Cover your cough with the bend of elbow or tissue. If a tissue is used, discard it immediately and wash your hands. Maintain a distance of at least 1 meter or 3 feet between yourself and others. This is especially important if you are standing by someone who is coughing or sneezing. Since some infected persons may not yet be exhibiting symptoms or their symptoms may be mild, maintaining a physical distance with everyone is a good idea if you are in an area where COVID-19 is circulating. What should I do if I have COVID-19 symptoms and when should I seek medical care? If you have minor symptoms, such as a slight cough, there is generally no need to seek medical care. Stay at home, self-isolate and monitor your symptoms. However, it is important that you do not ignore symptoms of fever. Seek medical help. When you attend the health facility, wear a mask if possible. Keep at least 1 meter distance from other people and do not touch surfaces with your hands. Seek immediate medical care if you have difficulty breathing or pain or pressure in the chest. If possible, call your healthcare provider in advance, so he or she can direct you to the right health facility.